about what to expect and what to request if you're thinking that your child might need an evaluation or someone has told you that your child should have an evaluation. So we can go to the next slide. So just to let people know, I do have some research funding with some particular organizations. None of them do anything related to what we're going to talk about today, and we're certainly not going to talk about medications. And my husband does also work for a pharmaceutical company, but not related to the field that I work in. So just to let you know. So I feel like when parents start thinking about an evaluation for their child, or someone has said maybe their child should get an evaluation, I feel like all the WH questions start floating in their minds, right? Well, who should we be seeing? Who can do what? What's going to happen? What testing might they do? How long is it going to take? How many times am I going to have to go? How do I even know if this is a good evaluation? And they're all good questions. And so we're going to try and tackle a few of those today, just so that you feel like it's a little bit less scary and a little bit less foreign if you're heading into one of these types of situations. Next slide. So I think one of the things that's incredibly helpful, both for the parent and for the clinician, is to have a sense of what the goal of the visit is, right? As a parent or a caregiver, are you going to this person because you want to know if there's a specific diagnosis like autism or ADHD or intellectual disability or learning disability or something else? And it's okay if you don't know. You may have been told your child needs to go get an evaluation, and you can name sort of some of the things you recognize as challenges, but you may not have a name for it, and you may not be looking for a name, and that's okay too. But I think if you know that this is something you really want to be answered in this evaluation, it's good to say that out loud to the clinician so that they can try and answer that question for you if they can. And as a clinician on my end, knowing what the family's concerns or questions are helps me to make sure that I'm asking the right things and getting the right information to be able to answer those questions. Next slide. And then another question that comes up is, well, who can do this? Who can make the diagnosis? And that's really tricky because it can vary a little bit from state to state and community to community. But in general, when we think about some of those diagnoses I mentioned on that last slide, in general, a physician or a nurse practitioner can often make that diagnosis if they've been trained. So in the state of Pennsylvania and the state of New Jersey, a primary care provider can make the diagnosis of autism if they've got the training to document what needs to be documented for next steps. In other states, in some areas, it needs to be a diagnosis that's given by a specialist, like a developmental pediatrician or a neurologist or a psychiatrist. And then there's a range of mental health professionals who are not necessarily in the medical field, but have the training and the ability to also identify many of these diagnoses and make that diagnosis as well. So clinical psychologist, a school psychologist, a licensed clinical social worker, depending on the area you live in, could be qualified to document what's needed for your child to access services. Next slide. And sometimes other people might also be involved, right? So it could be that the evaluation is being done by one person, like one medical or mental health professional, or it could be a team of specialists that are adding additional data and information. So I've worked on teams that include a speech language pathologist, occupational therapist, social worker, family navigator, and all of those people are adding really rich information to the child's diagnosis, but are sometimes hard to access. It can be hard to get all of those people into a room. So it's great if that happens. It's not always necessary, but just know that any person that's meeting your child over the course of an evaluation is adding their own pieces of data to help determine next steps for your child's care. Next slide. And then I think often this is the big question, right? What's going to happen? What should I be expecting? So if you know what your question or your goal is, that's great. But on the clinician's end, the person that's doing the evaluation, their goal is to gather as much information as they can to help figure out if there are specific diagnostic criteria that are being met, if there is a name for this, or at a minimum, what are the resources and interventions that they want to recommend to help your child reach the next level. So part of that is going to include an interview, and there's going to be lots of questions. They're going to be asking about, your child's early skills and what they were like when they were younger, those developmental milestones that pediatricians track in their well child visits. And they're going to want to know about current skills and how your child's doing compared to peers. They're going to want to know about behaviors, if there are any, particularly if there are any challenging behaviors that might be getting in the way. If it's an autism evaluation, they're going to ask some really specific questions about autism features. And if it's a medical professional like myself, we're usually going to want to get some basic medical background as well to make sure that we're not missing other things that need to be evaluated. Usually, while that interview is happening, if your child is part of it, we're going to be observing your child. We're going to be in my office, we're watching your child play, we're watching how your child interacts with people in the room and communicates. There may be some very specific testing that's done to get a better sense of developmental skills in particular areas. And in some cases, there may also be some specific diagnostic tests, which are usually in young children going to be very play-based. In older kids, they may be more kind of interaction focused, but less about toys, to get a little more details about how the child interacts socially and plays. Again, specifically, if we're looking at autism as a possibility. And then there should always be a time set aside for talking about the results of the testing, the diagnosis, and any recommendations. And that may happen in that visit, or it may happen at a separate time. Next slide. And so this is another one that I think families sometimes wonder, well, how do I know, how long should I expect this visit to last? How many visits is this going to take? And it can vary. It can vary depending on the clinician, on the clinical model that's being used, and the questions that need to be answered. Sometimes these visits are a single visit. They might be an hour or an hour and a half. Sometimes they could be multiple visits over multiple days. Sometimes they may just be, 30 to 60 minutes to get the basic information and think about next steps. Other evaluations, if you've got multiple evaluators involved, it could be 4 to 6 hours. And it's important to remember, shorter or smaller in terms of the number of people or how long someone is spending with your child does not necessarily mean that it's less effective. What's really important is this a good snapshot of your child? Did this person that's doing the evaluation see not the best day for your child, but the typical day? Did they see your child's typical skills being presented? And then what is their level of knowledge and comfort with these questions that you're asking of them? A good, well-informed clinician who has good clinical judgment around these diagnoses and is using some diagnostic tools to help inform their judgment, that's really the priority for your evaluation. And a good clinician who's got knowledge of these diagnoses and is using diagnostic tools will also be quick to refer you to other specialists or for additional testing if they feel like it's needed, because they want to make sure that they're not jumping to a conclusion or missing a diagnosis that's necessary. So know that if you're seeing one person and they're able to give you an answer, they're doing that because they are really confident. People are not quick to jump to these diagnoses. They are thoughtful about them. And so knowing that you have how many visits to expect, those are things you should ask when you're scheduling. How many appointments is this going to be? How long should I expect these appointments to last? And then know that you and your clinical team are going to figure out the next steps if more data is needed. Next slide. And this, I cannot stress this enough because it's complicated, right? It is really helpful for you or your evaluator to know what the rules are for accessing services for a particular diagnosis. So I'm going to use autism as an example, right? Depending on the state that you live in, what school district you're working with, what insurance company you have for your medical insurance, that might dictate who can make that diagnosis or how they will accept that diagnosis from a different provider. That might dictate what type of testing needs to be documented. If you know that your insurance or your state or your school system has a particular requirement, when you are making these appointments, it's okay to ask and say, I know we're going to need this. How can we get this done? Lots of families don't know. I think sometimes lots of clinicians don't know. We do our job. We do our clinical evaluation. But if there is a particular requirement that someone does know ahead of time, it can make it so much less frustrating for the family, for the child, and help you get to services and interventions faster. Next slide. And I think this comes up a lot. Families, will come for an evaluation and they'll get an answer and they'll ask, well, when will we reevaluate this? When will this get retested or reassessed? And what I will often say is, so it's not always something that's necessary. There are plenty of kids where the evaluation identifies a diagnosis like autism, and that diagnosis is probably not going to completely go away. And so if you as the parent kind of recognize, yes, my child has these features, the clinician has recognized these features, they've made that diagnosis, there's no need to put your child through another big, long assessment to confirm that diagnosis later on. There might be times that, a school district or a parent says, I'm not sure that I'm seeing these features anymore, that maybe this diagnosis isn't present. It's never unreasonable to kind of take a second look, but it's not something that's automatically done because we don't want to put kids through unnecessary testing. There are certain skill-specific assessments that can be valuable to repeat because those skills are going to change. They are going to continue to make gains in progress. So speech language evaluations, fine motor evaluations, learning evaluations, we need to kind of reassess those periodically to see this child learned new things. What are the new goals or what are the new interventions we should be thinking about? And then there are times, around transition planning when kids are a little bit older. So if you have an adolescent, someone that's, nearing adulthood, then that may be a time to do some additional reevaluations or new evaluations to determine if there are other things we need to consider. Do we need to think about other diagnoses like intellectual disability? Do we need to assess a child's ability to, an adolescent or young adult's ability to live independently and manage their finances and be employed and do these things that we expect them to do as adults? So that's a really important time to be thinking about what evaluations to consider. Next slide. So I think and this kind of, tees up this slide, right? So what are the age points that I feel like I'm often thinking about recommending that a family seek some additional reevaluation? So I think one time is sort of leading into if a child has been diagnosed or evaluated at a young age, they've been receiving services, they've been making gains. Around second or third grade, I think that's probably the most common age that we might be thinking about new learning diagnoses. And so if you have a child that's kind of plugging along, doing well, and then we hit sort of second or third grade and they haven't had an educational evaluation in a while, and they're starting to struggle with certain academics, that might be a time that you would want to get a reevaluation of their learning needs. Obviously, anytime a specific subject is creating more of a challenge, you might want to think about assessing to see if there's a learning disability there. Intellectual disability is something that should be considered, but isn't something we think about at a really, really young age. Little kids can have developmental delays. We want to monitor their progress. If a child has very significant delays in their development and they are continuing to be very behind their same age peers and they're reaching age 6, 7, or 8, we might want to think about, is this an appropriate diagnosis to name this significant level of delay? And then, after age 7, I feel like we probably shouldn't be thinking about this as a developmental delay. We should be thinking about this as a specific learning need or a specific intellectual need. And the reason that that's so important is because that does impact some of that transition planning that we talked about in the earlier slide. So if intellectual disability is an appropriate diagnosis, it is an important thing to be working with your team to identify, certainly before a child is reaching adolescent years and adult years. And then, for adolescents, again, thinking about transition planning and what are the types of evaluations that we should be assessing. Is this an individual that needs assessment for college prep and they're going to need some accommodations and specific learning supports in college? Is this an individual that's going to need assessment for independent living and work support? And those would be things that you'd be working with your team, your school team and your medical team or your care team to help identify what would be the best assessments. Next slide. And I admittedly, I stole these slides from our family partners who are part of this hub team because these are from the moms, right? These are the things to be thinking about before you go to any of these evaluations. And some of these may be more important than others depending on the age of your child, but I think make a list. Come with your concerns and your observations. That is so helpful to the clinician that's going to be meeting your child. Bring a partner or support person. If it's possible to arrange care for siblings so that both parents or more than one family member can be present, that's so helpful because it is a lot of information. It is an exhausting process. And so having another person that can help you remember what was said and take notes can be great. Make sure you're comfortable. Don't dress up for us. Be comfortable, bring what you need, bring water, bring phone chargers, bring extra diapers or change of clothes if kids are little, bring snacks and sippy cups. We try to have snacks here at the office as well, but you never know. It's better to have your own and the ones that your child will like. If this is a young child or a child that is a little more anxious in these kinds of settings, bring some comfort items for them, something that they'll enjoy that'll help them to relax during the visit. There will be downtime. There will be time that your child needs to be able to entertain themselves while you're answering some questions and talking. So it's good for them to have something that will keep them entertained. If you have other evaluation reports, or if your child is taking medications and you're not sure what the names of them are, bring a list of those things with you, bring those records with you. And certainly if you have any feedback from teachers or therapists or other people in your child's life, it's helpful to kind of have those multiple perspectives. If you have a particular provider or doctor that you want to make sure that the person seeing your child can communicate with or share resources and recommendations with, having that contact information is helpful. The front office is always going to want your insurance card. And, we are always at CHOP, we're always printing out recommendations for families to take with them. But I feel like it's always nice to kind of have your own notes, so that you can write down the things that are really important to you that you heard from the visit. Next slide. And I cannot stress this enough, right? As the caregiver, you know your child, your family member the best. And so we really are relying on you to share whatever information you can from your observations. What do you remember about your child's development when they were younger? What are the things that stood out to you? What were concerns that you maybe had back then? What are other people saying? Children act differently with their immediate family than they do with teachers and therapists. So it is good to get multiple perspectives. If there are other family members that have developmental or learning issues that have been identified, it's helpful to know that. And sometimes I think families are caught off guard if they haven't had a chance to ask grandma or aunt about other family members. Most of the visits that are scheduled, there's going to be some type of questionnaires that we're asking caregivers to fill out ahead of time. And so it's really great if you can take the time to fill those out, because those do help to inform the clinical judgment that we talked about and some of those diagnostic tools that we talked about. If you filled something out for another person, but you feel like it asks a lot of the right questions about your child, it's okay to bring a copy of that with you when you're meeting someone new, because that might help them understand your child better as well. And again, we couldn't stress this enough, like, you're your child's best advocate and you know your child the best. So we want you to speak up. We want to hear your thoughts. We want to hear your questions. This is really important, and it's only going to make the evaluation more meaningful and helpful if the clinician knows what it is that you're seeing and thinking as the process is going on. Next slide. So big key takeaways here, right? You should be treated all the time as an equal member of the team, and you are probably the most critical piece of the assessment team because you know your child the best. The assessment is always going to just be a snapshot. It might be 2 or 3 days of snapshots, but it's always going to be that one snapshot in time. So if you see something that really is not typical, sometimes it's that your child isn't performing a skill that they perform often at home, Or it could be the reverse. Maybe your child has done something for the first time ever that the clinician is seeing them do, but you've never seen them do that before. You should share that information. Both of those are helpful for the clinician to know. It's a lot of information when you're hearing about a new diagnosis or hearing about evaluation results. But if you have a question, please don't feel like you can't ask it. There is no stupid question. Ask it. You may not remember all the questions you want to ask. That's why that notepad can be helpful. And it is also can be an emotional time, and you should allow space for your emotions, and your clinician should allow space for your emotions. We understand that this is sometimes can be really challenging. I have families that are very emotional because it's hard. I have families that are very emotional because it's relieving and they feel validated. All of those are okay. All of it's acceptable and important. And then I think the most important thing as you're leaving a visit is to feel like you know what you're going to do next, right? What are the next steps? So that you feel like you're in control of things again, right? There might be lots of questions, there might be lots of unknowns, but do you know what's happening next? When will you get the results? What are your next action items? And I think those are the most important things that you can do to kind of take control and take charge of your child's care. And I think that's the last slide. So happy to open it up for